Hello, I'm Pennsylvania Secretary of Health Everett James. Since the mid-1960s, our Commonwealth has provided newborn screenings. What we knew then remains true today. Newborn screenings save lives. Under Act 36, the Department of Health now provides for screening and follow-up services on 28 genetic and metabolic conditions. While most newborn health conditions are rare, early testing can make a significant difference in a child's development. It can improve the overall quality of life for children, particularly those with special health care needs. Our mission is to promote healthy lifestyles, prevent injury and disease, and assure the safe delivery of quality health care for all Pennsylvanians throughout their entire lives. Our work begins with our citizens at birth.
My name is Melita Jordan. I'm the Bureau Director of Family Health for the Pennsylvania Department of Health. I oversee all of the newborn screening services in the state of Pennsylvania, along with other public health programs that deal with maternal-child health. Our vision in Pennsylvania for newborn screening is to link our newborns at birth to preventative services and to make sure that we can screen for all preventable diseases. And so, in doing so, this is an opportunity to provide families with the medical services that is necessary to prevent inheritable diseases from causing any major illnesses and/or disabilities. Act 36 really is the codification of the Newborn Screening Act, and it is the additional 22 supplemental conditions that the newborn screening program will now follow. Pennsylvania has been following the 6 mandated screens, and now with Act 36, we will be following the 22 supplemental conditions. We're going to take a moment to review all of the disorders that require screening and follow-up services under Act 36. First, here are the 6 mandated conditions that we've been screening for many years. Now, with the creation of Act 36, the Commonwealth of Pennsylvania is requiring follow-up for an additional 22 supplemental conditions. These conditions are also divided into several categories. Here they are. Additional screening is very important in order to detect a congenital abnormality as well as an inheritable disease, and to start early intervention. And early intervention will prevent disorders and long-term consequences for families. Medical home is a concept that really supports coordinated care within a family-centered environment within a child's community. The medical home provides for the PCP, or the primary care physician, to be the point of contact for a family, to be the gatekeeper in helping the family navigate the healthcare system. So it is extremely important that a family is engaged with this primary care provider in order to get the other services that are needed. Newborn screening is more than just testing. Newborn screening is a follow-up service, that provides comprehensive services that includes testing, diagnoses, as well as treatment. And therefore, the medical home is an environment that fosters that and supports that. The legislature has deemed the Department of Health as being the responsible agent for overseeing the 22 additional follow-up diseases. However, the Department of Health must work in collaboration with a number of other stakeholders, internal as well as external stakeholders. And that includes our screening laboratories, and we have 2 screening laboratories. We also have the Bureau of Labs, our own lab that does the quality assurance for the Pennsylvania screens. In addition to, we work with our treatment centers and also our endocrinologist. The increased reporting helps the Department of Health not only to assist the hospitals, families, and treatment centers with the information, but it also will provide us with a tremendous amount of information that will help us be able to collect data that will enable us to determine, do we have pockets in the state where there is an increase in incidence of a particular disease, and or it's an opportunity for us also to make policy change. So the purpose of a health department is not only to gather the data, but also to use that data to analyze it, to see how does it improve the health care and the quality of services for the citizens within its state. And this would be an opportunity for Pennsylvania to gather that information and then help make policy decisions along with the legislature and the governor's office. The doctor's responsibility in all of this is to provide information to the family, treatment, and follow-up, and get to a diagnosis. And so what we want to do is provide the necessary information to nurse practitioners, physicians, and other providers, and giving them a comfort level of knowing what resources are available to them as providers to share with their clients and or patients. So knowing what referral centers, knowing what phone number to call for information, to know what facilities to access, and what guidance to provide parents within their community and at the state at large, that we could really help. Because in helping a parent navigate the healthcare system and getting their child or their family members to the right specialist and provider, not only reduce their burden of emotional upset, but it also will help in the long run to minimize the kinds of services that may become detrimental to a young person as they grow older. We also have a newborn screening manual that is provided to all providers of healthcare services, and that information provides detailed guidance to our newborn screening program, as well as answering a lot of those frequently asked questions that a practitioner may not have at their fingertips that the provider manual is able to give some insight into. And we can provide that with a hard copy, and we also provide that through our website. Additional information can be obtained by contacting the Pennsylvania Department of Health, the Division of Newborn Screening.
Newborn screening really first started back in the early 60s through the efforts of Dr. Robert Guthrie in New York. PKU, or phenylketonuria, had been shown to be caused by a deficiency in the enzyme phenylalanine hydroxylase, and that leads to an accumulation of phenylalanine in the blood. That amino acid is a normal building block of protein, but if it builds up into too high a level in the blood, as happens in these babies, it becomes toxic and damages the nervous system. So Dr. Guthrie developed a very, very simple test called the bacterial inhibition test. The big advance in newborn screening that led to the need for something like Act 36 was the application of a technology called tandem mass spectroscopy. And what this is it's a very, very fast and very accurate way of measuring the composition of a variety of different chemicals or metabolites in any fluid. In this case, it's done on blood. So you can take that same blood spot that's now on a filter paper, and you can process it in a way that allows you to use the mass spectrometer to look for a variety of chemicals that we know accumulate in these different inborn errors of metabolism.
One of the chief misconceptions that people get confused about with newborn screening and PKU is that they keep calling it the PKU screen. And that's just something that's left over from the 60s because that was the first one. Actually, it's not PKU screen anymore, it's newborn screening. And with the advancements that we have right now, often with like what they call something called a supplemental screening, which some hospitals do, you can pick up like 55 genetic metabolic diseases using just one simple blood spot. What we're doing these days in the state of Pennsylvania, starting July 1st, we're expanding state screening to an additional 22 categories that above the original 6. And that's done through a blood spot. So after 24 hours, a hospital will do a blood test. It goes to a laboratory. The laboratory will see something abnormal. If they see something abnormal, they report it to the state, who also contacts one of the treatment centers. These diseases are very rare, sometimes a 1 in 100,000. The average pediatrician and family practice person is not going to be able to know all that thing about diseases and not expected to know all these things about these diseases. So besides looking up in a book, what now they can do is refer to a center. The Metabolic Disease Treatment Center really is a referral center. And what it's there for is a place where we have expertise to help family practice, pediatricians, internal medicine people, who take care of children. And the center, in conjunction with the pediatrician and the family practice doctor, we help them take care of these children. We have the expertise and the laboratory expertise, which is unavailable to the average pediatrician.
We also have in place genetic counselors who can help the family understand the genetic implications of these conditions and what risks might be for future babies. We have specially trained dietitians who can help us design diets tailored to each of these disorders. Many of these disorders are treated solely through dietary manipulation as opposed through a medication. And then, of course, we have the other support staff to make sure that the flow of paperwork continues, that we're able to get all of the correct information back to the state for follow-up purposes.
The idea is earliest intervention possible, earliest contact possible, 24 hours a day, 7 days a week, 365 days a year. That's what we want. Because we want to make sure that if this disease process in any way could harm the baby, we're on top of it right away. So it's the state working with the hospital, working with the pediatrician, working with the metabolic center, working with the laboratories. They're all playing an important part. Hopefully we can all work in a synergistic way so that we are on top of this right away and that we're all on the same page. Long-term follow-up for metabolic disease is very important, and it's really a simple thing. What happened in the past was, because we weren't really detecting these diseases early, a lot of people died. So there was no long-term follow-up in the census. We didn't see adults with a lot of these diseases because the adults were dead before they became adults. So what was important is that now that we have the capacity to be able to figure out what disease you have and what treatment you have, now we have long-term follow-up is even more important for two things. Number one, to get enough data to figure out if the treatments are working. And number two, to see what actually happens to adults. Whereas the people died at 5 or 6 or 7 or 10 or 12, now we have people lasting to like 25, 35, 45, or 55.
While most of these disorders are rare individually, in aggregate they're actually quite common. 2 to 3% of all babies born nationwide have a genetic disease, and 2 to 3 per thousand have one of these inborn errors of metabolism. If you do the math, that translates to probably 10 to 20,000 babies a year born with one of these conditions, all of whom are at risk of dying or having serious medical consequences.
What we're seeing is that when we're seeing these children now, we're able to do something for them. They're surviving longer, having better lives, and that's what really counts.
Before my children were born, I never knew anything about newborn screening. I'd never heard about the tests that they were going to do in the hospital. I really didn't know anything other than a little bit that I read in parenting books that I had taken out of the library before my children were born. My name's Judy Griffith, and I have 4 children. 2 of them were born with PKU. Neither of my doctors had ever discussed newborn screening with me. The first time I'd heard of it was when I was in the hospital and my son was getting his test. They did come in and say, you know, we're taking your son, we're going to do the testing. When Charlie was about 7 days old, I was out taking a walk, and we came home and there was a message on the answering machine from the pediatrician, and they said there was a problem with the PKU testing. We need you to bring him in right away so that we can retest him. So I was a little panicky. I called, they asked me to call. So I called right away. They were actually out to lunch at the time. So I was panicking, trying to read on the internet, called my husband, I was crying, upset. I read about it in my parenting book, and it just said that PKU results in mental retardation. When we went to the doctor and they redid the testing, they didn't really know much about it. They told me they had never treated an infant with PKU at that time. So I had a lot of questions for them, obviously, and they were not able to answer most of those questions. They didn't know, they just kept saying, you need to wait till you see the specialist. After we came home from meeting with the specialist, we were then pretty much on our own with support of the dietitian. The dietitian played a big role in supporting the patients. Pretty much I was in contact with her on a daily basis to go over what he ate. We had to take him to the Department of Health for blood testing when he was first born every 2 days so that we could monitor that his levels were going back down. As they got older, it gets a little easier because then they start on food, but you're in constant contact with the dietitian because as they get the blood tests back, they change how much protein they're allowed to eat every day. I've become an advocate for newborn screening and early detection because I feel that it's important for parents to understand these things and to know what's going on. And I don't want parents to have the lack of knowledge that I had when my child was born, the fear, the many questions. I think it's important for doctors that deal with pregnant women and young children to really understand PKU and other metabolic disorders as much as possible because the parents don't understand. And if they did, they would do more to help protect their children. And I think a lot of parents will say, I'm not interested because they don't really understand the consequences and what can be prevented by just doing that testing. And they need the doctors to provide that information to them so that they can make the right choices. Finding out that my children have PKU and finding that out very early in their lives has really made a difference in their futures. I mean, now they are both doing well in school, they play sports. We believe that all of this has happened because of the newborn screening test and because of the follow-up that we've received, the education from the clinics, and the support that we've received has really made a difference in their lives. I mean, they wouldn't be what they are today without it.
Early diagnosis and treatment are vital to a baby's health and peace of mind for parents. Our department, along with screening laboratories, healthcare providers, metabolic treatment centers, and a supportive medical home, can make a real difference for a newborn suffering from a lifelong disease. For more information on newborn screening, visit the State Department of Health at health.state.pa.us or call 1-877-PA-HEALTH.